This lecture is going to be on causes of hypocalcemia. Here are the main causes of hypocalcemia. This lecture is going to be on the first 4 causes. Hypoparathyroidism may be either primary or functional. Primary hypoparathyroidism is due to immune-mediated destruction of the parathyroid gland. Dogs with hyperparathyroidism typically present with neuromuscular signs attributed to marked hypocalcemia, and the hypocalcemia is frequently less than 6.5 milligrams per deciliter. The phosphorus is typically normal, but it may be increased. Functional hypoparathyroidism occurs when the parathyroid tissue is present, but PTH is not being adequately released. Lush grass contains low concentrations of magnesium, and this results in hypomagnesemia in the patient. The hypomagnesemia causes decreased secretion of PTH from the parathyroid gland, and it decreases the activity of PTH in the tissues. As a result, the hypocalcemia can be severe, and neuromuscular signs may also be seen. Blister beetles contain a toxic agent called cantharidin. Cantharidin is absorbed by the GI tract and excreted in the urine. As a result, it can cause GI and urinary tract irritation and hemorrhage. Horses can present with either mild to severe colic and dehydration. Cantharidin also inhibits the effects of ADH on the kidney, so it is a potential cause of diabetes insipidus. Hypomagnesemia may also occur, but the mechanism for the hypomagnesemia is unknown. Cantharidin also affects the cardiovascular system, causing increased cardiac contractility, vasoconstriction, and endothelial cell damage. Pancreatitis most commonly occurs in dogs due to a variety of predisposing factors. Dogs are often dehydrated due to vomiting and inappetence. Vomiting may be apparent on the blood work as decreases in sodium, chloride, and potassium with a metabolic alkalosis. Inflammation of the tissue surrounding the common bile duct results in compression and occlusion of the common bile duct. As a result, bile cannot be excreted, and this causes cholestasis and hepatocellular injury. Inflammation within the pancreas results in acinar cell injury and release of the digestive enzymes that are within the acinar cells into the abdominal cavity. So those digestive enzymes digest the adipose tissue, and fat is released from the injured adipocytes. Those fats combine with calcium to form calcium soaps. The calcium precipitates out of solution to form these soaps, and when it does that, it's called saponification of fat, and it's present in this picture as these white foci on the pancreas. Oxalates are metabolites of ethylene glycol, or they can be ingested by eating oxalate-containing plants. When large animals eat oxalate-containing plants, the oxalates bind calcium within the gastrointestinal tract, and the calcium is not absorbed. When ethylene glycol is ingested, the liver metabolizes ethylene glycol into glyoxylic acid and oxalic acid. These metabolites bind calcium within the animal and precipitate out of solution, forming calcium oxalate crystals. Ethylene glycol metabolites are renally excreted, so the calcium oxalate crystals primarily form in the kidneys, resulting in renal tissue injury and organ failure. Laboratory findings of ethylene glycol toxicosis include acute renal failure, an increased anion gap, and calcium oxalate monohydrate crystals.